My name is Amy Otteson. I'm a psychologist. I work primarily with children and youth. I work for Horizon. I've been working here for the last 15 years. So everybody has some fears. We actually develop fears usually when we're kids, and sometimes those progress to adulthood. For example, I'm afraid of octopuses. I find them to be very creepy. Squids, jellyfish, eels, anything like that make me scared. But I do not have to see octopuses every day in my life. I can look at them in an aquarium, I can think about them, I can talk about them. So it's not a specific phobia. I wouldn't meet the criteria for a diagnosis of a phobia. So what differentiates a normal fear that we all might have and a phobia is really the intensity of the fear and also the impact that it has on our functioning. So a person who has a phobia has a very intense fear of whatever it is that they're afraid of, and it can be lots of different things. But it also has a significant impact on how they live their life day to day. So for example, if a person was afraid of dogs and they were on a bus, we'll say, and somebody had a service dog on that bus, they may have to, be late for work because they had to get off the bus because they were afraid of seeing that dog. Or they may cross to the other side of a street, or they may not go over to a friend's house who has a dog, and that can have an impact on their relationships. So we tend to develop fears when we're children. So between the ages of 7 and 11 is when most phobias develop. And it's normal for kids to be afraid of things. And if you think about why, it's because when we're growing up, our brains are learning what's dangerous and what's not in the world. And we need to have experiences in order to learn. So oftentimes kids will develop a lot of different fears of different things, like clowns and the dark, and various things that are quite common. If a fear persists into adulthood, it's likely to stick around. But during childhood and even adolescence, our fears sort of wax and wane. So if somebody has a family history of anxiety disorders, they are more likely to develop an anxiety disorder. But certain phobias are more heritable than others. So actually fear of animals is one of the phobias that has a higher rate of heritability. Also fear of blood or fear of getting needles. Now part of that could be genetic. We also have to consider the fact that many of the things that we kind of go on in life to have are things that we've learned. So for example, if I had a parent who was very afraid of dogs, they are not going to take me around dogs. So I'm never going to have the opportunity to learn that some dogs are nice. I'm always going to think that dogs are dangerous, and I'm never going to have experienced dogs that are nice. So I might have a higher chance of developing a phobia because my parent also has that phobia. But likewise, any phobia has a component of learning to it. So if I, for example, am afraid of elevators and I never go in an elevator, I'm never going to learn that elevators are generally safe. So it really is a combination of nature and nurture. Some of us have a genetic predisposition to be more anxious in general, and those people may have a higher rate of developing phobias, but we can also develop them if we don't have any history of it, just based on our learning experiences. A lot of people with phobias do develop their phobia after experiencing a traumatic event. So say for example you were eating something and you choked on it, you may then develop a fear of choking. You can also develop a phobia from observing something happening to another person. So if I was swimming and I watched someone next to me who almost drowned, I may then develop a fear of drowning. We can also develop a phobia from hearing about something. So for example, a plane crash or a shark bite, those are things that don't happen very often in our lives. So usually if someone's afraid of sharks or someone's afraid of planes, it's not because they've experienced a plane crash or a shark bite, but it's because they've heard about it. And then the fourth way that we could develop a phobia would be if you had an unexpected panic attack in a feared situation. So say you were waiting for a subway on the subway platform and you all of a sudden developed, symptoms of panic, like heart racing and feeling like you're going to die. You may then be afraid to go back to that subway platform and develop a fear of subways or being in enclosed spaces. So what's kind of interesting too is that we could have a fear, like my fear that I mentioned earlier of octopuses. And if I really avoided thinking about octopuses, being around octopuses, going swimming at all in large bodies of water, my fear that is maybe lower could develop into a phobia. The other thing is a lot of people don't have a reason, or they don't have a specific event that happened to them that they can pinpoint that led to why they're afraid of something. All that to say is that it could happen for many different reasons. So the treatment is something that is called exposure therapy. You may also hear it called systematic desensitization or cognitive behavioral therapy. But essentially what it is we will, in small steps, put a person into a situation that causes them a little bit of fear. And the person will be taught strategies to help to kind of calm their body down, and strategies to think about what's going on and what the danger actually is. And the body eventually will kind of learn that the situation is not as dangerous as they initially suspected it to be. And over time and with gradual exposure to the different things that they're afraid of, the person can learn that the threat is not as dangerous as it is. So with the example of dogs, I would not throw you into a pile of vicious dogs. That would not be the treatment. So if you are looking for treatment for your phobia, you don't have to be afraid that, the psychologist is going to say, okay, let's go to meet a bunch of Rottweilers that probably have rabies and we're gonna make you hang out with them. That's not the treatment. So what we would do first, we would maybe look at pictures of dogs, or perhaps we would watch some videos of dogs. Maybe we would learn about different types of dogs and the rates of biting, for that breed or something like that. Maybe we would go in a situation where we would see a dog from a distance, and then maybe we would get closer to the dog in a room, but you don't have to touch it. And then perhaps we would eventually move to just touching it with one finger. So we would continue to progress along a scale, and I'm talking about dogs, but this could be with any type of fear, until you get to a point where your body and your brain are able to tolerate being around the thing that you're afraid of without freaking out and having a panic attack and needing to leave the room. If you're a parent and you have a child who has a phobia, I would say to try to encourage the child to, in small ways, be in a situation where they are able to experience the thing that they're afraid of and learn that it's something that may not be as dangerous as they think it is. For a loved one who is an adult, you can encourage and support them in helping them to kind of maybe try to test their fears a little bit. A lot of times, as a loved one, we can, we use the word, accommodate our loved ones and the things that they're afraid of. And if we're accommodating them, it's not going to make the fear or the phobia go away. So encouraging them, to seek support and to maybe try to fight their fear could help the person in the long term. But if the person isn't ready for that, or if it's something that they don't want to do and it's a decision that they don't want to take right now because it's too much for them, then that's okay as well. I think that we can't force another person to overcome a fear. It's best if you're in a relationship with a person to just be a good friend, be a good partner, and help them to seek the support if it's something that they want to do.